Hi, everyone. Welcome to our Fireside Chat.
Prior authorization inherently has always been manual, provider abrasive.
Along the lines that Eric mentioned about addressing the pain points of HealthHelp always have invested on the next wave of technology.
I think AI and particularly large language models are really well suited to this.
Hi, everyone. Welcome to our Fireside Chat, Smarter Utilization Management with AI, Insight from the Front Lines. I'm Kyle Kanega. I lead growth at HealthHelp, and I'm joined by a great group. Looking forward to a great discussion. I'll introduce them to you. We have Eric Hummel, who leads medical management at Geisinger Health Plan. Dr. Chris Lovejoy, who is from Anterior and leads clinical AI and engineering. And I have George Germano from HealthHelp, who leads product and strategy. So looking forward to a great discussion with all of you, talking about AI and Would love to start really with you, Eric. Talking about traditional challenges, thinking about what wasn't working, what was broken maybe, and what really pushed you to think about doing things different, looking for a vendor, some challenges that you're looking to overcome.
I appreciate the question, Kyle. Prior authorization inherently has always been manual, provider abrasive. This abrasion has caused a significant strain, really, for lack of a better word, between the health plans and the providers that are requesting the services. This administrative burden oftentimes, inhibited the true intent of the prior authorization process. It was manual in nature. Providers, spend a lot of administrative efforts to fulfill the requirements of the prior auth, as well as the health plans to effectuate any type of decision or the appropriate decision based off that. So essentially, we looked around and said, what can help this process? Not looking to replace it, but enhance it, make it better. And the logical answer here is any type of administrative streamlining through AI or any type of technology-based services to enhance this process.
That's great. George, Chris, would love to hear from you too, and thinking about how you're trying to add value here with our partners.
Yeah, I'll go next. Thanks, Colin. I appreciate the question as well. Along the lines that Eric mentioned about addressing the pain points of HealthHelp always have invested on the next wave of technology. Just looking forward and saying, how can we address this pain point? We've done this in the past with EMR integration, different clinical lines, different technologies. And quite honestly, AI is that next wave. So as we look at what AI offers, back to Eric's point, it addresses those key pain points. It lowers provider abrasion, simplifies the process significantly. It continues to increase the clinical integrity, more precision, and better evaluation of the cases. And also it does this by bringing true value, continuing to lower medical costs. For those reasons, in a comprehensive way, we decided to move forward with the AI solution as well.
Yeah, and I think just to build on that, I think definitely agree with the points Eric and George have mentioned. I think we really saw that there are a lot of payer workflows which have large amounts of unstructured data that require clinicians to manually work through that data. It's very time consuming. Obviously errors can happen. And I think AI and particularly large language models are really well suited to this. They can process large volumes of data. They can easily generalize to different settings. And I think it's therefore, been a very nice match between what the pain points that exist are and what the current capabilities of AI are today.
That's great. That's really great. Well, we'd love to talk about partnership. We brought these three organizations together. Maybe start with George and Chris, and Eric. Would love to have you chime in. How did your organizations come together to do this, and sort of what made sense to make the collaboration really work?
So going back, a year or plus or so ago, when we did a market scan to figure out who should we partner with, right? Well, first decision was to make that we're going to partner with somebody because the technology is moving so fast that we realized that we need to have the right people to actually maintain that pace of technology changes. So as we look at the market, we picked Anterior for three reasons, really. One was focus on health plan. Technology for sake of technology is one thing, but really focusing on a solution that understands the business processes and how to bring value to a specific segment of healthcare is important. So, and the focus that Anterior has on health plan was very critical to the decision making. Second one was ability to bring the right technology. So we did evaluation, proof of concept, and everything else. We understood quickly that are using the best and the right technology for this solution, right, to address the pain points as you mentioned earlier. And quite honestly, the third part was the team. We're able to immediately fall into a rhythm. We're able to collaborate. They are very flexible and agile about meeting our needs because let's say how it is, right? One solution doesn't fit all clients. So having the ability to work together, figure out the right configuration, figure out the right modification, made us comfortable that we're going to get there. We picked Anterior, and we're not looking back. It was the right decision.
Yeah, and I think just to add to that from Anterior's perspective, I think HealthHelp really we saw as a great partner. I think in particular for their clinical expertise, and that really enabled a very strong collaboration between the clinicians on our team, the clinicians on their team, and they can talk the same language. And one kind of like cornerstone of the Anterior approach is that we take this forward deployed approach. We have engineers and clinicians that work very closely with our partners. They will map out the way that partner performs their workflows today and really kind of embed that within the AI system. So you have this clinical native expertise and this clinical native approach. And that's been very helpful for us. You know, we call it clinician-driven AI iteration, where the clinicians will always monitor the AI performance, identify how things could be improved, and then we're really proud of the turnaround times that we're able to then achieve of kind of this iterating very closely with the customers to improve things.
Yeah, Eric, love to hear your perspective from Geisinger. Yeah,
absolutely. We all know there's mounting, pressures, legislative pressures coming from state and federal levels on, making the prior authorization process better. Geisinger, we're always looking to structurally re-engineer and push the innovation envelope. And so we looked for really leveraging emerging and what I would say proven at this point technology in response to the prior authorization simplification process. AI is an easy answer ish. It's easy for the end user. There's a lot that goes into it. So understanding the complexity of how this all works. I think we look to HealthHelp and your team to really put this into place to streamline this process, make it, just more simplistic from inception of request to the effectuation of the decision and really the lifespan of the authorization itself. Using AI where to assist as needed, make the provider's life easier if it can be, gleaned from integration or attachment, document review. Then let the decisions be made in a more simplistic manner. Eliminate what doesn't need to be asked to the provider because it's already gleaned from the AI and machine learning and kind of integration, if you will. And really just provide a more quality-driven, quality output program that really facilitates better judgment, better decision-making, more transparent decision-making, which I think is extremely important in this process to share with our providers so that we're all kind of collectively working on behalf of the member or the patient and not adversarially against each other. So this really does bring those components together. And so that's, we kind of look to this group to come up with something and couldn't be more pleased with those results that we have so far.
that's great. Yeah, I love what you said. Eric, all this, we're trying to make it easier for the providers. And like you said, Chris, it's engineers and clinicians working side by side to really try to bring something to be more efficient. So let's talk about, real world impact, the type of results that we've been seeing, both, operationally, clinically, financially, how's it been going? Eric, we'd love to hear from your perspective, what you're seeing from your side on the health plan, and then George, Chris, would love to hear, your perspective as well on how it's going.
Yeah, absolutely. Again, I think, the providers are extremely vocal about the administrative abrasion that the prior authorization process breeds. And so what we've noticed so far is that AI and kind of this partnership has helped really lead to quicker decision turnaround times. But it's not just about the speed and the expeditious review of this. It's about getting to a increased accuracy and better quality outcome for all involved. It really builds upon the relationship between payer, provider, and patient, and ties those together. So what we've seen is, again, lower turnaround times, quicker and more accurate decisions that lead to a more quality-driven outcome for our members.
I echo everything that you said, and just to put a number or two on the stats you mentioned, on the turnaround times, we noticed a reduction anywhere from 50 to 70% turnaround time reduction on the cases that usually go up for escalation to a clinical person. This is truly driven by the fact that AI now have ability to actually process that large volume of data that Eric and Chris mentioned earlier, be able to go through charts extremely fast and really come back with a recommendation within a minute or two, right? So that ability to actually have that answer back, that case would have gone to a nurse's queue and sit there potentially for a day or two, now turning around in a couple of minutes, makes the provider to get the response much, much faster, and makes it much, much better for the member that get that response for the test. Is it approved or on the spot while the patient is still in the office, right? So that turnaround time improvement was significant, and it was noticed by the providers, and the NPS scores went up significantly.
Yeah, and I think just to add to that, I think from our perspective, probably the metric that we're most proud of as part of this collaboration is the 76% reduction in approvals that require a human review. So these are cases, as George mentioned, that would have needed human review and would have ended up with an approval anyway. But the fact that you're able to do that in an automated way can really transform the impact on the patient. They can get their approval straight away and kind of go on about their lives. And I think the kind of underlying driver that made this possible, I think, was ultimately the accuracy of the AI. And out of the box, when we first started working together, we were able to get 95% accuracy, which is a pretty decent starting point. And I think testament both to the power of large language models as well as a lot of internal work that we've done. But then after kind of collaborating very closely with HealthHelp and their clinicians and their very kind of forward-focused technology centered approach, we were able to get that to above 99%. And I think that kind of level of accuracy is really what enables you to drive these real-world changes, such as automating these approvals, as I mentioned.
That's great. That's amazing. I mean, when we think about value, we're always thinking about operationally, of course, financially, but really, we're looking to try to deliver better outcomes and experience for members, providers, and of course the health plan. It really sounds like, I mean, these numbers, you're all talking about are just exciting. So that's great. We'd love to talk about lessons learned. I mean, we've been doing this. Got to learn something from it. So, what advice would you offer to others that are considering AI and utilization management? George, would love, what would you say to that?
A couple of advice I'll give. One is partner with the right partners, right? Obviously, both on the technology side and on the client side, right? To make sure that they are open to change. I guess the second advice I'll give as part of lessons learned is have a good process, a good governance process, right? Making sure that, because it's a new technology, right? Making sure you have the right oversight as you get into it. I think Chris alluded earlier that both of our teams had a meaningful governance process, both on the technical side, but more important on a clinical side, making sure that we're doing the right thing, right? This is a clinical solution. So both teams have actually human in the loop that provide the right oversight and with the right processes and the right checkpoints to make sure that this is done right. And that gives you the confidence in that to expand further.
Yeah, to be honest, I think my top two learnings would really be the same as George. I think finding the right partner is really important. Having the right internal processes is also really important. Maybe some points I would add about finding the right partner. I think, the kind of collaboration is really important. Having somebody who understands healthcare. Obviously, this technology, AI, large language models, they're very powerful, but really what unlocks that is when you actually truly understand the end workflow that you're trying to operate in. And I think that's important, and that's kind of underlined a lot of our collaboration. And I think another thing also worth calling out is that you really want to be able to have explainability and auditability of your AI system. I think one trap that you can fall into is having the AI as a kind of black box decision making agent. But I think with if you architect things in the right way, you can actually then get full breakdowns of how the AI has come to its decisions. That enables you to then bring human in the loop to do this kind of auditing and internal quality assurance processes, which I think is really important when we think about using AI safely and effectively. But I think, the kind of high level points here, basically echoing George, that the partner is important and the internal processes are important.
That's great. We think about what's next. What do you think the future of AI is in UM and even beyond UM? We'd love to hear, just think forward thinking a little bit. George, what do you think?
Well, for us, it's a bit more tactical, right? So in the near term, we are working obviously with both partners on the technology side as well as our clients to expand AI utilization across all our clinical lines, right? So making sure that we adopt it in the right way through the right processes that we just mentioned. So we adopt it across the full portfolio. And then also work with the rest of our clients to make sure that they adopt it, they're comfortable with it, and so on. In addition to that, we're going to start looking into the other aspects of our business beyond just the clinical component of it. How do we adopt AI on different business processes, be that intake, the voice capability, and so on, because the value is there and is real.
Yeah, so I think thinking about this from like a technical perspective, there is a common element across a lot of areas of UM and even outside UM that is, you have large amounts of clinical data, which is kind of a mixture of structured and unstructured data. And then you'll have also some sort of rules or some sort of logic that you want to apply. And I think large language models have really proven that they are very good at working with large volumes of data and handling this kind of nuance in these logical rules. And so I think utilization management is a very natural starting point here. And obviously, we've done a lot of work here, and many people are working in this space. I would say, just a few other areas that extend beyond this and follow that same sort of like fundamental element are things like risk adjustments, reading long medical records, extracting ICD-10 codes, and identifying appropriate patient risk. I think also care management is another example, where you have teams working across member engagement, care coordination, disease management. Today, you might have some sort of like simple analytics in place, but actually with AI and with large language models, you could read every chart, physician notes, all of the unstructured clinical data. You can flag care gaps, you can track outcomes, you can personalize outreach. There's really like so many different ways that you can use AI today with these new capabilities. I think we will see really an increasing expansion across many different areas of
just to add and echo, I think as the health plans look at this, prior authorization, there's no finesse in it, right? Historically, it was more of a lump procedure to really capture and try to contain and drive to quality outcomes. And so AI and machine learning, language processing and all the good stuff that comes with that really drives home more efficiency in the way of the lower complexity level cases. AI could probably take care of and really allow the reviewers to focus on what we would consider the more clinically complex. So it's not like a one size approach anymore that fits all. It's more tailored to the human and that needs the care. And so my advice to anybody looking at this is it's not every company is created equal. Technology is not all the same, and always keep the human in mind, because there are real people that need care. And what we're looking to do is get to the most quality-driven outcome in the most efficient manner possible. And by doing such, that enhances the member's life or the human's life, also makes the provider's job easier, less administratively burdened, and also at the same time, the health plan end users who are using the platform drives that quality outcome. So it really dials into what you need to look at. It helps assist the reviewer, it helps assist the process to focus on what needs to be focused on, through what we talked about earlier, what doesn't necessarily need a human to review and auto approve or approve it, I shouldn't say, or adjudicate it. through approval. And we could then focus in on those ones that might need a little bit higher level of scrutiny or care or any type of intervention, or even working with the provider. It allows our team to spend more time with the provider. And what we want to see from this is develop a process, in closing, is develop a process that really puts the health plan on the same care team as the provider and not on the opposite side. So using and leveraging technology, leveraging AI to really bring this full circle to be part of the care team to assist for better outcomes for every person that needs healthcare in the delivery system.
That's great. That's really great. Well, it definitely feels like this is the beginning, and feeling like there's a lot of opportunity to come to really support members through their care continuum. So, um, really, really appreciate the conversation. Wrap up here. It definitely feels like a very exciting time. When you think about AI, we think about healthcare in general, but right now, we're seeing just significant opportunities. And I really, thinking about clinical expertise, AI engineering, and coming together to really deliver value for clients, and to Eric's point, members and providers, trying to make the experience better for them. So appreciate the conversation. If anyone is interested in talking about AI and or beyond, would really just encourage you to reach out to us. We'd love to talk about it. But thanks so much for the conversation.